Yo, and you are my yagina, who are do anyway. And in Ray, ye be and Komo Kakra Afa COVID 19. We are seeing that the beer who are only a bay our Bacassa Odia, you're a man found. She's a China for a empire, must see a yagina, much experience. Some way COVID 19, if you have China in 31st December 2019, China government reported WHO said they had strange cluster of pneumonia cases. Na wɔmbɛhwehwɛ mu no ɔmuhu sɛ efi virus no na virus na yɛ virus foforɔ a ebi wie a ɛmba wiase da enti wɔmotu edin sɛ novel coronavirus kyerɛ sɛ coronavirus a yɛnhu ebi ɛda na yare a ɛde baeɛ no ɛna wɔmotu din sɛ coronavirus disease of 2019 ɛno na ɔmtwa no short ɛyɛ COVID-19 na aboa nankasa etu ne din as severe acute respiratory syndrome coronavirus type 2 nti ɛno na wɔatwa no short ayɛ no SARS-CoV-2 na ɔhwɛ aboa no a ɛyɛ round sei na etua mbɛbɛn bi ɛwɔ wɔ so a wɔfrɛ no spikes na spikes no ɛna variations ɛbɛ mu na variations na ɛba spikes no mu no ɛno ɛna ɛde mutations ne ba spike no so ɛna ɛnam so determine baabi a ɔbɛkɔ akɔban de nti nipa mu sei no wohwɛ yɛn ehwene mu ne yɛn upper respiratory tract na ɔhɔnom na spike no enya receptors a yɛfrɛ no ACE receptors na ɔma ban de nti ɔhɔnom no ɛna ɔmfa ewura body no mu ɛno nti na symptoms no bebree naa no ɛyɛ ebia respiratory symptoms sani yɛbɛka ɛyɛ sani ɔhome ebia na ɛma ɔbɔ wa ebia ɔmo mu yɛ ɔya na ɔntumi nhome na afei deɛ ama ɔ fever nti ɛkɔ so koraa ɔde hu na ɔnum ato na ɔnte mpampan so these were the initial and real symptoms of SARS-CoV-2 nti sɛnea meka no aboa no sei na ɔteɛ ketekete bi na wotwa mu a ɛyɛ round ayɛ sɛ crown nti na ɔmo frɛ no corona no wọn sɛ corona na ase kyerɛ sɛ crown ɛna spike no ɛwɔ wɔ so a ɛde ɛba nipa no mu nti new one a wɔn aba a yɛfrɛ no omicron no within the spike no it's got about 32 mutations na ɛno ɛma no etumi escape some of the existing resistance na human na build no nti ɛma no spread faster within every 2 days no etumi double. Iti kopa na coronavirus no say na tie baby anaba ben kokoro no won na abetna nipa no baby a friend receptor then it then gets embedded into the human body then it uses the human mechanism to multiply the virus enti onye wurem ketewa bi a wankasa o system no na use na dey multiply enti saa no ekọ into lungs na affect your lungs, then you cannot breathe. That is the main area where it affects. And it's 2019 COVID-19, and the first one I shall say, no, coronavirus novel, it said not even bad, so it was the wild type. Now, sir, initial one, and as I say, woman and mutations are it actually begins to behave slightly different. Baako ɛyɛ alpha ɛnu ihu Kent baako yɛ beta a ɔmo ɛno ɛwɔ South Africa gamma ɛnu efi Brazil delta efi India ɛna omicron South Africa foɔ na tu din ba ɔmo kyerɛ sɛ na ɛwɔ hɔ dada asama ɔmo ato din te sɛ ɛna ɔmo tutu din no edin no ɔmo ɛfɛ Greek alphabet mu Greek alphabet alpha to omega nti saa na ɔmo yɛ alpha beta delta gamma into a variant of concern. Variant of concern, which I say, original one no hona, bibi kakra bi asesa na me asesa nti ema no ekọ enu ententem. Saa mre wo mo alpha to lambda na che say A to L. Enti ka next one no o say eye M a eye nu na so o ma nya anko. If some say nu no any new no confusing. Enti alpha sɛnea mkaa no efi UK and beta no efi South Africa gamma delta then it becomes more infectious. The kind variant of interest and also to me as there, but and spread it to say a variant of concern no as spread no. Enti yenti a omo it jumping from new any chi to omicron na say omo new no I say new variant it makes it a bit confusing if by the time I will do omicron not new variant no why old enti otu new enye and a chi no so China president Xi Jinping obviously there's a China virus and there's a discrimination and omicron now, women is based on the mutations within the cell structure and the cell membrane. Now, these are the various results that come out of it. Now, be a mutation for then there's another wave of COVID. It's April, that was the novel coronavirus. No? That is when the first wave of COVID came. And and then by the time you go into the alpha variants, no, spread, there was a second wave. Then by the time India for the delta wave and another, and then there are new variants, then there's another one. And it says here Omicron, which is another strain abbey that gives us concern. So there's going to be another wave now. December monthly, that's the highest cases of Omicron of COVID virus ever recorded. And the new cases and the deaths are as the variants come, the deaths go up, then it comes down. Once the first coming down was based on the availability of vaccines, and then it was controlled. Then after that, we had another variant, and then with the variant, it all changed. And then you get a vaccine, and then it all gets down. It's at the moment a race against the virus, trying to find a single vaccine that will be able to do the job for us. We are seeing now US for the most cases. Now at the moment, there's been over 5.3 million deaths with 269 million cases. In fact, in Nipemua, it's about more than a quarter billion. And yes, I agree. The focus at Yari way and Yari government in the day, Shem Kofua, mental massive. Yari a pa a kum and for hospital and go for or more relatives, healthcare professionals or more share, young so Yari. There is no way so because it's a live illness that is going on worldwide. Now, Usha graph it shows you the global trend of the cases by continent. For some reason, Africa was not really affected. The African eye blue, the next one that was really affected was South America. Now, I don't know, Brazil, mostly any Peru, and Asia, Nanka also be spared, but time a Delta strain strike here, then that brought it on. And if baby a blue spike now, baby a Delta strain spike in India, that brought on a new wave. Now, who's a China and Gasa and virus, the Shas here, no, you won't tell the Yanya baby. A credit and all China ho. Now, Ocean North America, also many baby, and only US, and then Europe, of course. Europe, we are leading the number of deaths in terms of COVID worldwide. And see, where some clever man be share and say, oh, yeah, so how has the data matched with what people have been doing? And you see, in January 2020, Tama COVID no, yeah, shall see and oh. We are Baba Sisia, Trump virus, it will disappear as magically as it appeared. Oman fine yet be serious until all of a sudden it spiked up that US UK for going to full lockdown. And during the lockdown, cases went up and then it gradually came down with the easing of restrictions. And restrictions didn't easy na nipa yɛgya yɛ mask nyinaa hyɛ ne ahyɛ aseɛ sɛ ɛdura fi koraa sɛ ɛne saa virus yi ɛna teɛ. Then kakra, all you need is to have a new variant, and then it all starts going up again. And the virus, mama yɛnhwɛ no yie, ɛfiri sɛ yɛno no ɛna ɛte ase. We yɛ graph a ɛkyerɛ the various distributions in Europe. We ɛkyerɛ the doubling time of the various variants. And the first wave now, which is the original COVID original SARS-CoV-2 and the one strain now, it was using 1.3 days to double. Into 1.3 days, say within 1.3 days, it can double in 1.3 days. Then in another 2.6 days, in NIPA 4. Then by the time I another 1.3 days would become home, which is about 3.9 days now, and NIPA 8. And that's the doubling time. It's the shorter your doubling time, the more quicker the virus spreads. It means that Omicron, the doubling time you're 1.2. So we are very, very alert as to how it's going to be. These are the COVID-19 cases in terms of Europe. And and then we should test as much as we need to. So, and making sure say we are negative before we go into church. If you're going to go into any place which is a gathering, and if you've got symptoms, please stay away. Now, if you also are having any symptoms, please do your testing. Test. We have to be each other's keeper during these times. We have to encourage people to go for the jabs. We said the jabs are very effective and they do protect. Memma obi enada say jab no emobia baby sansam no mokin na enye nokre. Jabs no are effective and they are the only reason why with the subsequent wave we don't have as many deaths as we had in the first wave. Na near physician specialist back oye adwuma ewo ICU aka ye ne say ICU is full of the unvaccinated. And my patience with them is wearing thin. You can say, one hour, say, Yari, maybe a minjindi, na, min word journal. Just say, or see, in about 5 years' time, Adia or Nubenya cancer. You can say, at least, with the best now 5 years, never been many cancer. No, now, dear, Ubenya COVID, no, our hospital, 5 years, no problem. And Moma Yambo Moding. Na yenko sa COVID vaccination no, let's take part in it. SDA for your official statement and say we partake in public health activities. We are fully involved in any activity that takes prevention into consideration, and so we are fully joined up with this COVID vaccination project, and members are encouraged to go for the vaccination. And see, they all can say coronavirus or vaccine, they are using up all the resources within the NHS at the moment. Or say latest news about this year Ghana plus or na vaccinated udu on my airline charge $3,500. Na we are Ghana near Uduhai, but you near Booby and Sana with me real. And see, Sanya and Yama Elkono, there is issues about COVID passport, vaccine issues, a B cry, COVID-19, no, and 666, the pro. Sanya Mawina and Yano Craig. And see, Oma Yanshe. Tama eshasi ya nanko for kase COVID-19 no wofa ebetumi a change DNA na ensem basa bebre wohwe internet so utie WhatsApp a wanhwe a wobewu na adepa bi ebehwero. Enti at the moment the game in town is the vaccine, and we've got various types of vaccines. All the ones that have been approved are effective. At least since we've been doing the vaccine for a year now, and most of the initial fears have been debunked. Say your friend was a vaccine, patro koji. Say when your vaccine so patro, yeah, and she na kojo vaccine. If you say maybe a vaccine not just a yapa. See, mama, some may be to me, I vaccination. Then trust you vaccination. Or say, enti, osha vaccination na. Before any warrior cry, before so the amount of they almost say vaccine hesitancy before meko graph back so na yahwe what's our graph or say graph we are what has say na almost a big gap remains in uptake among blacks, South Asian, and mixed race relative to white residents age 60 and above. Above now, our 95%, no, now before I was 69%. South Asians, they own so, and from what I say, I didn't know before young what saga be. Na wɔn de nsɛm bebree na wɔhwehwɛ mu ka sɛ ɛno nti na before wɔn gya bi wɔn hyɛ da yɛ research bi wɔ Queen Mary's University na the study that was done at Queen Mary University London no suggested say there were various factors Mr. Smith na kebi wɔn say they identified 13 different themes related to vaccine uptake that surrounded barriers to vaccination, such as misinformation or personal beliefs. Misinformation, and no, Anna, a yakasiya pa, now what's up here, piamba, she said, Obi ko vaccine, and say, a yato. And also, no, just say, and some anya no cra. Or say, the article found out that older people from ethnic minority backgrounds were less likely to be vaccinated if they did not know about the vaccination program. And he said, and then if you say, na adia baako cramp permit by any say, me chiramo say vaccine no, yeah, me uncle wa, na mitminya nipa baako cry, I can't work one, and then beji. That is all I'm trying to do to erode the vaccine hesitancy amongst us. Or say, before no, a ya woman GDA, healthcare system nim nti mo mpese ombeko na emum no se ebusuani bi anase cultural leader church elder anase mpanyimfo bi anase healthcare professionals bi ebeka trom se vaccine eye adwuma enye omo egitu nti me patro me kan o eye adwuma mo modern opinion back one or yeah research my friend Dr. Dipesh Gopal when you're carrying or see during the pandemic many people saw viral videos on COVID-19 and vaccinations being sent through WhatsApp groups and social networks and a lot were spreading disinformation not representative of the up-to-date scientific evidence. And yeah, you feel before no, if minority backgrounds no, you show am I say so enti say ya hambo modern ambo edru ya no etumi kanye na esa so etumi kuntem obisi o na say o vaccine na still etumi nya yare no I hope nya yare but you not get a severe one we cry a very mild one enti omo hwehwe mu na enyema can say affecting people. The first one say misinformation and lack of information. Misinformation just for ashada edi acro around say vaccine no enye. The second one perception of good health will be so media me ho ye dimi vaccine there be vaccine yes o ho ye anasa o ho ye sisi akọ ICU a won a ho the amantia and mabawa because they did not vaccinate and they engaged in risky lifestyles. Or say the perception that you have a healthy immune system and that vaccination is for the weak people is wrong. Ebi mo so say, oh, maybe I may exercise because me exercise, na maybe I may hygiene, it protects me against disease. Yes, it protects you, but the extra layer of protection you get by the vaccination is very, very beneficial. Oh, if you see, oh, vaccine, a craft, and I shall say, and him say, Bay, and I say, Yajuma, to see, that just for 1 year. Shall say, maybe see, oh, vaccine year, the 1 year, and a year, it, you mean, say, a young natural, and a bit changing in DNA. The vaccine does not enter into your nucleus, and because it doesn't enter into your nucleus, it doesn't alter your DNA. The vaccine has been going on for a year now. Say, time I shall say, and you pay when you hear vaccine, you hear vaccine by also a failure, and also acquire a sample for. It's mistrust in healthcare system, and no, a tie or and said the initially through the slave trade, because in the areas where the slave trade was done, they had bad experience of the healthcare system. Because of the negative past experiences to healthcare system, they have less trust in Western medicine. Now, so actually, the vaccine, there's no difference between the word before and the word before. It's as effective. Before, we should also take part in the research so that when the vaccine comes out now, and I say anything comes out, it's representative of us. As I'm back one, what research you know, say, the sign as a supportive community. You know, you will say Ghana for a country for a gag. Now, almost say, what encourage friends, family, and the social community, the cultural leaders this is able to improve the vaccination numbers. And woman, yes, so you now, me say, men can say, obi asam emfa wo da. Sure, mami ba na what collapse ato from na doctors and nurses you go so na afege you say yen resource no go business you vaccinate you when you COVID. Men can so bi asam emfa wo na wo me bi na ofie no nya COVID media e dey asem bebre ebeba. Yen can say wo vaccinate you when you COVID maybe by to reduce your chances, and even if you get an illness you be less ill. Nti we vaccine hesitancy. Then say major now has